Welcome back, everybody, for another Medvarsity Deep Dive.
It's great to be back.
Today, we're going to be looking into sepsis,
Okay.
which is something that can come up in pretty much any area of medicine.
Mm-hmm.
So it's a good one for us to dig into a little bit deeper.
Yeah, for sure.
And we have a real-life case to
Yeah.
discuss, which I think will help to illustrate the points nicely.
Yeah, that's always helpful.
So sepsis, for anybody who might not know, is when your body's response to infection
Right.
actually starts harming its own tissues and organs.
Exactly.
So it's kind of an overreaction of the immune system
Mm-hmm.
that ends up causing more problems than the infection itself.
Yeah, it's like a good thing gone bad, right?
Right.
The immune system is trying to fight off the infection, but it goes a little overboard and starts attacking healthy tissue as well.
And then the case that we're going to be talking about today involves Ludwig's angina,
Right.
which some people might have heard of it,
Mm-hmm.
but it's not exactly a household term.
No, it's not something you hear about every day.
So maybe we can start there.
Sure.
What is Ludwig's angina?
Well, it's a severe bacterial infection that affects the floor of the mouth.
Oh, okay.
So as you can imagine, that can be pretty dangerous because it's right near your airway.
Oh, wow.
And it can cause this rapid and aggressive swelling that can block your breathing.
So I'm already sensing some urgency here.
Absolutely. Yeah, it's a condition that demands immediate attention.
Yeah, no time to waste.
Every minute counts in these cases.
So let's back up for just a second, make sure everybody's on the same page about the basics of sepsis.
Sure.
So we talked about it being like an overreaction of the immune system,
Mm-hmm.
but can you kind of break down exactly what's happening in the body?
Of course. So when bacteria enter your bloodstream,
Right.
your body normally launches an immune response to fight them off.
Right, like it should.
Exactly. But in sepsis, that response goes into overdrive.
Okay.
It's like the immune system gets a little confused,
Mm.
and instead of just targeting the infection, it triggers this widespread inflammation throughout the whole body.
So even though it's trying to do the right thing,
Mm-hmm.
it ends up causing more harm than good.
Precisely, this uncontrolled inflammation can lead to organ damage, and if it's not treated quickly, it can be fatal.
Oh, wow. So recognizing the signs early is really critical here.
Absolutely. Catching early is key to improving outcomes.
So what are some of the red flags that we should be looking out for?
Well, some of the common symptoms include fever, rapid heart rate, low blood pressure, and confusion.
Okay, those sound pretty straightforward.
They can be, but the tricky thing is that these symptoms can also be quite subtle or even atypical, especially in older patients.
So it's not always a clear-cut presentation.
Not at all. It can be very sneaky, which is why it's so important to have a high index of suspicion for sepsis, especially in patients who are at higher risk.
And to make things even more complicated, you were saying that even the heart rate can be misleading.
Yes, that's right. You might expect to see tachycardia, a rapid heart rate, which is common in many infections.
Yeah, that makes sense.
But sometimes you can actually see bradycardia, a slow heart rate.
Really?
Yeah, it sounds counterintuitive, but it can happen in sepsis, especially as the body's compensatory mechanisms start to fail.
So it's not a reliable indicator on its own.
Exactly. You have to consider the whole clinical picture, all the signs and symptoms together to get a sense of what's really going on.
That's why it's so important to have that experience and that eye for detail.
It definitely is. Experience helps you to connect the dots and recognize patterns that might not be obvious at first glance.
So with all that in mind, let's go back to our case of Ludwig's angina.
Okay.
What were the initial steps that were taken when this patient presented?
Well, the medical team recognized the urgency of the situation right away.
Right, because like you said, any swelling in that area can quickly block the airway.
Exactly. So they immediately started empirical antibiotics.
Oh, okay, so they didn't wait for the culture results.
No, they didn't have time. They needed to start fighting the infection as quickly as possible.
So those are broad-spectrum antibiotics, right?
Yes, they cover a wide range of bacteria, so they're a good choice when you need to act fast and you're not sure exactly what you're dealing with.
That makes sense. And what about the airway issue?
They addressed that right away, too, ensuring the patient could breathe.
Okay, so I imagine that could involve some pretty serious interventions.
It can. In severe cases like this one, it might even require an emergency tracheostomy.
Wow, that's a procedure where they create an opening in the neck to allow air to bypass the blocked airway?
That's right. It's a last resort, but it can be life-saving in situations like this.
So breathing secured infection, being fought. What else was done?
They also drained the pus, which is essential for addressing the source of the infection.
Okay, so that helps to clear out the bacteria and reduce the swelling.
Exactly. And once they get the culture results back, they were able to adjust the antibiotics to specifically target the bacteria that were causing the infection.
So it's a multi-pronged attack hitting the infection from all angles.
Yes, it's about being aggressive and proactive and taking all the necessary steps to give the patient the best chance of survival.
Wow. This case really highlights the importance of quick thinking and decisive action when it comes to sepsis.
It definitely does. Time is of the essence, and every decision can have a huge impact on the outcome.
So we've talked about how crucial early detection is,
hmm
but it seems like it can be pretty tough to spot sepsis in its early stages.
It can be, especially when the symptoms are subtle or atypical.
So how do we get better at recognizing it earlier?
Well, thankfully, technology is playing an increasingly important role in sepsis detection these days.
Oh, really?
Yes, a lot of hospitals now use automated early warning systems that constantly monitor patients' vital signs and lab results.
Okay, so they're kind of like an alarm system for sepsis.
That's a good way to think about it. They can flag potential cases of sepsis even before they might be obvious to a human observer.
That's incredible. And what about the future? Are there any other exciting advancements on the horizon?
Absolutely. Artificial intelligence is showing a lot of promise in the field of sepsis detection.
Oh, wow.
AI algorithms can analyze vast amounts of patient data to predict the risk of sepsis even earlier than those automated systems can.
So it's like having a superpowered doctor constantly analyzing data in the background.
In a way, yes, it's an exciting field with the potential to revolutionize how we approach sepsis.
It's amazing to think about how technology is changing the face of medicine.
It really is. It's constantly evolving and opening up new possibilities for improving patient care.
So despite all of these advancements, sepsis is still a major problem worldwide, right?
Unfortunately, yes, it remains a leading cause of death in hospitals around the globe.
Wow, that's a sobering thought.
It is. The mortality rate for untreated sepsis can be as high as 50%.
50%, that's a really stark reminder of how serious this condition is.
It is, and it highlights the need for continued research and innovation to find better ways to prevent, diagnose, and treat sepsis.
And we can't forget about the challenge of antibiotic resistance.
Absolutely. The overuse and misuse of antibiotics have led to the emergence of drug-resistant bacteria, which makes treating sepsis even more difficult.
It's a catch-22. We need antibiotics to fight these infections, but their overuse can make them less effective in the long run.
That's the dilemma we face, and it's why responsible antibiotic stewardship is so important.
So it's about using antibiotics judiciously.
Exactly. Only when they're truly necessary and
Right.
making sure we're using the right antibiotic for this specific infection.
And that's where the culture results come in handy.
Yes. Once you know what bacteria you're dealing with, you can choose the most effective antibiotic and avoid using broad-spectrum antibiotics unnecessarily.
All of this really underscores the importance of knowledge and experience.
It does. As a doctor, you're constantly learning and refining your skills because the more you know, the better equipped you are to handle these complex cases.
That's a great point. So it's not just about memorizing facts.
No, it's about understanding the underlying principles and being able to apply them in real-world situations.
And about recognizing those subtle clues that might point to something more serious.
Exactly. Sometimes it's the little things that make all the difference.
So it's a constant process of learning and adapting.
It is. Medicine is a dynamic field, and we have to stay on top of the latest research and developments to provide the best possible care for our patients.
And I think that's a great message to end on.
I agree.
The importance of continuous learning and never stopping to ask questions.
Absolutely. That's how we grow as clinicians and ultimately how we improve patient outcomes.
Well said. So thank you so much for sharing your insights with us today.
It's been my pleasure.
And to our listeners, thanks for joining us for another Medvarsity Deep Dive. We'll be back soon with more fascinating cases and medical discussions.
Until next time.
Take care.
You too.